Dr. Ian Smith, how are you?
Great, thank you. And yourself?
Oh, I'm doing pretty good. You know, I feel pretty good talking to you because I actually came to your challenge when you came to St. Louis at Union Station a couple of years back.
Oh boy, did we have a good time, huh?
Yes, we did. I actually still have my $50 million pound challenge T-shirt,
Yeah.
which is great. I still wear that, and it was a great day that day.
But Joe was performing. Remember Joe was performing that day?
Yes, it was.
Oh, it was great. I saw
And you also had Biz Marquis.
That's right. We had Biz Marquis on the Wheels of Steel. You better believe it. Curtis Blow. It was great. We had a good time.
It was a great day.
Yeah.
Let's talk about this 50 million pound challenge to help patients manage their diabetes. So what steps can we take, or my viewers could take, to control diabetes themselves?
Well, the good news about type 2 diabetes is that it is so controllable and manageable. And doing simple things like changing the types of food that you eat, staying away from refined sugars and high-calorie foods, and replacing them with foods that are higher in fiber and other vitamins and minerals can make a big difference. Also, regular physical activity. Trying to get in 4 days a week, about 45 minutes per session of regular physical activity can help control your blood glucose levels. And so we're excited because our new partnership between the 50 Million Pound Challenge and CVS Pharmacy will make a big difference in giving people all the resources they need to help understand and manage their disease.
You know, Dr. Smith, please help me out with this. You know, I've got a brother who works for the government, and he says, you know, when I'm working, I'm exercising. I say, no, you need to do other exercise. Is that a good suggestion or a bad suggestion?
No, it's a wonderful suggestion, especially depending on your age. I mean, the younger you are, the more rigorous the exercise needs to be. Now, listen, if you're someone who works with your hands, if you're a construction worker or something like that, yeah, working sometimes can be exercising. But when we say exercise, we're talking about getting your heart rate up, working out that cardiovascular system. So just walking around the office and lifting a box here and there is not really the exercise we're talking about. It needs to be sustained amount of rigorous activity to get that heart rate pumping.
Definitely. Now, who's at the greatest risk for diabetes?
When we talk about type 2 diabetes, we talk about the risk factor of those being over the age of 55, those who are overweight, those who have a family history, and those who are of African American or Latino descent. These are the major risk factors. And so we're trying to get people to realize if you have one or more of these risk factors, you really need to look at the education part of diabetes and get yourself screened, because you know what? 6 million Americans are walking around with type 2 diabetes and they don't even know they have it.
Wow. How can CVS Pharmacy, how are they helping diabetes patients and their families?
This is the way it's got to work, James. I got to tell you, in order to stymie and to set back this whole business of the diabetes epidemic, we need corporations, major corporations like CVS Pharmacy, who are going to say, listen, we're going to be part of the solution and try to help out. And that's why this partnership is so important for everybody, because they have so many programs and resources that can help people manage their disease, help people with the cost of managing diabetes. It is going to be so tremendous. And so we have two very good websites that are free to access, 50millionpounds.com, which you're well aware of, as well as a new website, cvs.com/diabetes.
Dr. Ian Smith, thank you so much for the information. You know, I got a brother who's got type 2 diabetes. You know, and like I say, I'm trying to get him to go to the gym. It's like pulling teeth.
It is tough, but let me tell you something. When you get them there and they start realizing the results, then they will stay there, believe me.
That definitely. Dr. Ian Smith, thank you so much for joining me.
All right, take care.
Thank you.